since 2001. I would have loved to call him an Oyo boy too, but a part of his life was in Calabar. But then he's the founder and chief executive officer of Excellence Community Education Welfare Scheme. Most of us know it as ECEWS. But he is and has always been very consistent on ensuring that capacity development never lacks, especially around us. I think this event has brought some of the biggest. I can announce that he's the highest employer of labor after government in Akwa Ibom State today. He's the highest. And it makes me feel proud. It makes me feel proud because his head office is in Akwa Ibom State. In fact, to make matters worse, his head office is in Waniba. But ladies and gentlemen, he has presence in over 14 states, I think. 15 states now of the Federation. Employs close to 40,000, I think. 4,000 individuals across those branches. I think that's a very good place to put your hands together. And so, from Uyo to all over Nigeria, ECEWS has done wonders. And today, speaking to us on leveraging digital media to improve primary health care and community engagement, please welcome Dr. Andy Ayo. Put your hands together for him, please.
Thank you so much. And thank you guys for inviting me. I had to bring this so I look a little savvy, right? So maybe you can tell that we use the digital tools as well. Thank you, organizers, and I've seen a lot of good old friends like Goyo and I was just wondering to myself, we love young people, that's the truth, and we love young influencers at most. We want to congratulate Akwa Ibom for the 10th, this is the 10th edition, isn't it? Of the social media. This is the first. Okay, I saw the 10th somewhere. 10th anniversary, okay, fantastic. So I think for me, I run a very crazy schedule, but this was something I was speaking to Dr. Bala, thank you for coming. That's our state director, so thank you. Please round of applause to you. And some of the guys, so they actually put the slides together, but because I said young people are very important to the work that we do. We actually are in it to serve young people as well. Entrepreneurship is very vital. And I think for me, one of the things we value is when we see young tech entrepreneurs. I had two friends from the US visit within the week. They just off to Abuja this morning. And we continue to talk about how young people, how we can earn money outside of here. And I see all of you, I'm excited to come see people who are actually earning money through social media. Am I clear? Is that true? I mean, seeing and speak to all of you, it means this is the place I really, really want to be. I want to be in a place where we can share experience. I mean, beyond public health and beyond sharing what we do, but also try to share some of our little stories here and there and to say, look, it's possible for you to achieve. And recently, in process, we're trying to bring Microsoft certified courses right into our state. So we're partnering with Microsoft Nigeria we've already hired the Microsoft certified trainer, and we hired some business developers. And the big picture is we want all of us certified within the state, and it's really about you. So that's why it was also vital for me to come around. Leveraging digital media, I mean, it's openly talked about. Social media cannot, or digital media cannot be underemphasized. Just like it said, we started way back 24 years ago, and we're going to be 25 next year as a company. It's just a small idea. Frankly, not a very big thing, but little things grow, little things make sense over time. If you're consistent and if you keep at it. if you're consistent and you keep at it, and you're genuine and you're authentic, the challenge is AI. AI we must grab, generative AI we must bring into the picture. I'm doing a Harvard Business School course now. We're discussing a lot of generative AI and how best, now the challenge of authenticity, challenge of originality, even with AI. And as social media, and all of you use AI tools, isn't it? So again, how do you engage? How do you train? How do you maximize that? How do you use that for solutions? So I want us to, sort of see that maybe it's possible to cause change if you also generate a strong brand, isn't it?
Yes.
If you're loyal to the brand, but you're also authentic. And I like what Ian said, do the things that are original to you. Don't just get on social media and abuse people alone. If that's the path you want to follow it very, I don't know. But because it does work some places. I mean, the US president does a lot and is very popular for not being as authentic in some of his ways. So ECEWS is a non-for-profit. Like I said, 24 years ago, we have all of these partnerships. We have a website. We also have a lot of social media handles, both on Instagram, Facebook, and Twitter, or X, as the case is. We're not yet on TikTok. But I see TikTok is really, really impressive, isn't it? We want to run away from TikTok because, again, I see a lot of Gen Zs here. And we're also beginning to think like, look, TikTok is a place we have to go to because so much is happening there, so much influencing is happening there. And for us, we believe in empowering people. We empower both young people and women and all of that. And I think empowering you to get at wealth, getting exposed is important. And that's why, again, just going back to what that guy said, what the guy said, it's like we're really trying to understand our space because exposure is so vital. Exposure is what? So vital. Training is so important. So let me just, before I get into this slide, say we must be very intentional about training. Just be very intentional about it. I'm doing a short course, like 6 months in Harvard Business School. I finished in January. In fact, I have a deadline for today to submit a few things, but I just said, no, let me come have this 1 hour session with you guys and maybe share, and luckily have Dr. Bala who can share more. And let's go through some of our values. So go ahead. You will see innovation is key for us in ECEWS. I think one of the things that really helped us out is innovation. Innovation, really, really coming cutting edge. What's your competitive edge? What makes you that person that somebody wants to listen to? Are you getting me? That's what we try to do for ourselves. Innovation, key, mutual respect, very, very important. Okay, maybe I'll go with our mandate. We're very God-centered. It doesn't take us, we're not religious, but we're Christian. The two things, isn't it? Yeah. Huh? Yeah. So you have to be open-minded, because if you're not open-minded, you really can't make progress. That's it, they shall be rebuild the old waste, the ruins of former deletions. I mean, Isaiah 61, 4b. But our vision is clear, achieving quality life. Go on. You can look this up on our website. It's often easy to, I don't know who's flipping that, or do I want to help the person out? Thank you. So mutual respect is also key, I mean, among what we do. And I think I want to, while it's not very commonly all the time, but it's good to have mutual respect. I think we don't respect each other that much on social media. Sometimes it's also business like not to respect people, isn't it? But it doesn't last too long. If you want to have a long-term brand, build on authenticity, isn't it? Be authentic, have an honest background, people will keep connecting with you. Accountability. Just tell us about ECEWS. So over the years, over this 24 years, maybe between 2024 up until now, we've engaged with so many partners, largely the US government, US Centers for Disease Control and Prevention, the World Bank, USAID now defunct, UNICEF, all of the UN systems, the Global Fund, recently Islamic Development Bank. Yeah, keep going. Sorry. If you can just keep flipping. Thank you. Yeah, keep going to the next one. Forget. So these are all different partners that we relate with at different times. Elton John, Bank of Industry, and they're actually more than this. Islamic Development Bank. We do work across public health, education, as well as economic strengthening. Yesterday I was in the market where we met with some of the women that we provided small grants for, and they're doing well. With just $100, they've done well over the past 1 year, and we're now thinking, can we invest more? We've done that for close to 300 women in market women in Akwa Ibom. So, and but beyond that, empowering young people, we're part of even the Youth Fashion Week. We're supporting entrepreneurs. We're going to be part of a trade fair for young people in a few days by Anyekan. And you know, why? And that's why I came for the social media meet. How can we really make sure that you also take advantage of opportunities that may exist? Because you have skill set that can be maximized, isn't it? You have skill set that can be maximized. We also produce content in ECEWS, if you want to say the word. There's a lot of content that you can leverage on, both from people like us or people across the world, to use to make sure that your work is impressive. Yeah, next slide. So we have quite a number of staff, core staff across the country, over 600. Those are core staff who have like health insurance and all of that, and that's quite a bit. But we have a lot of community workers, maybe almost 3,700 of those are community workers, so across the country. What do they really do? Case manage, follow up with patients. For instance, in Akwa Ibom, we care for over 145,000 people living with HIV. We support all the facilities. We support malaria in Enugu. We support work across the country, frankly, even in the US. We're also a registered charity in the US. We're doing some projects. We did some project in Iowa, and I think we have another one set up for Missouri soon. The picture for us, if you look at the primary healthcare sector in Akwa Ibom, go to the next map. We have over 500 primary healthcare centers, and primary healthcare should be like your first place of accessing care. And how do we really get digital solutions around? I thought that number was wrong. I think we're in 104 of the 535. So we're not in 313. That's a bit wrong. We're supporting work across these facilities, but we also have what we call community-based centers, the TBAs. We support a huge number of these TBAs, I think over 200 of them. 321 across the country, about 321 of them. And they are like small hospitals, isn't it? They deliver women all of the... and then for us as a state, we do recognize the need for so much of work. And then when we say digital media, we're looking at social media, mobile apps, websites, telemedicine. Telemedicine is really referring to you sitting in your room and accessing care with somebody just through your phone, right? Or through other media. I actually had a consultation with my doctor in London last time just through Zoom. That was telemedicine, isn't it? And I booked the appointment. I actually paid for it. It's expensive. Some of us don't like to pay for that. But that's exactly where we are headed to as a country. You need to pay for these services. Websites, mobile apps, we've generated quite a number. So how have we leveraged on digital media to improve primary healthcare in Akwa Ibom? I think one of those special areas, if you keep flipping, thank you. Yeah, go to the next one. Health education. So health education is key, and I think that's where all of us here are going to be extremely important. Among our population, a recent survey, which is not yet totally published, still proves that about 4.8% of Akwa Ibom people have HIV, which is absolutely it's a bit sad because, or 4.5, yeah, now dropped to 4.5, 4.47. But it's not really out there now. It soon will be. So they'll give us all the dynamics, despite the work that has been done. But it also comes down to your population. So between 15 and 40, the prevalence is still significant. And one thing that we've noticed, and that's why you're also very important to us. Yes, we focus a lot on the science and biomedical intervention across facilities. We're ensuring that loads of people who test for the virus and come down are on drugs, and that they virally suppress a large number of them. But also a couple of facilities. Remember, we're in 104, isn't it? And maybe 160 something facilities, including secondary healthcare facilities. There's so many places, so many young people that are still, their risk perception is still low, isn't it? Right? And that means the ability to take risk is still high. And you are very important folks to us. So you will be very important for our work in terms of, sharing content, sharing with your friends. Maybe you should have a CSR component to making money, isn't it? Like a corporate social responsibility for your brand. And that also gives you brand, brand relevance, if I want to use the word, isn't it? Yeah. Where people say, okay, this person is just beyond making jests, is beyond, just talking other things that don't count. The things he does that really count, isn't it? Yeah. I think some of us can build into that. And I've discussed that with Dr. Bala and his team. We have quite a huge team here, whom you can all leverage on. I don't know whether it's an association. Is it an association of social media practitioners? I don't know. Absolutely. Yeah. I love that. I use social media. You should make me a member. So I think the picture is we all need to, you should. You should, and I want to be part of it. Because we must get in that space that is influencing the world. I use social media a lot. I also encourage us to use LinkedIn. LinkedIn is a professional social media that I think we stray away from, but it's also, there are some serious people, so there are also serious things you can pull out there. I can have water, that would be, thank you. So, you can, we've done so many campaigns with social media. If you go through our Instagram page, we have campaigns that, World AIDS Day, World TB Day, World Malaria Day, education, International Men's Day that just went by, International Women's Day. So we use the social media constructively to build perception and create pathways for young people, isn't it? And for old people. Everybody goes to the social media. If you gauge people's timeline in 24, or let's say they have 18 hours without sleeping, isn't it? The doctor says you sleep between 6 to 8 hours, isn't it? Many of us sleep less than that. But 18 hours of the day, they work maybe somewhere around 6 to 8 hours, right? How much time do you think you spend on social media? Probably, I don't know the science around it, but I think people spend a lot of time on social media, isn't it? Again, so brand attraction. So how do you, we have a strong, we've been developing a strong brand attraction over there because we put an ad on our website. The last time I said, don't put it on social media, just put it on our website. And we have close to 100 people applying. And I'm like, okay, and so many impressions coming through. So I'm thinking that's something that we've achieved, which I also, like I said, one of the communications I'll be doing here is while telling you about public health, also try to see if I can introduce a few things to how you do what you do. So we need you because we do a lot of work here in health campaigns, telling people how to wash their hands well, telling people to be conscious of non-communicable diseases like hypertension, isn't it? Check your blood pressure, right? I don't know, these days we're seeing young people with kidney disease, isn't it? And we're seeing young people with diabetes, right? And that's because we think it's beyond us, isn't it? But it's not really. Something that social media can really bring some of these information to the fore. And if you do, people are going to take you more seriously as a media, as a brand. If people think that you are talking about hypertension, you're talking about diabetes, and you're giving them accurate information, connecting with sources like ours, then you would have conveyed some degree of relevance to your brand. When people begin to think that you're somebody, your traction may increase. Yeah, sometimes good things don't bring many people, bad things do, isn't it? So, in the middle of the bad things, create some good things, isn't it? Bad things in quotes, right? Okay, so one other way that we've done that for social media is, I talked about blood pressure. If you go to the next page, you will see we did a social media campaign for health insurance in River State. We're supporting Shell Petroleum Development Company with their health insurance in River State, now Renaissance. And, it's interesting that, that simple ad, we had over 1.4 million folks reaching that and about 5.7 impressions. I think I was impressed, isn't it? And right now, that's the power of the social media that can improve health. People now gaining a health-seeking behavior. That's something we're trying to do in Akwa Ibom State now. Like trying to ensure that many people get a health insurance because that's so important. If you have health insurance, then you don't have to think about money in your pocket if you're sick, isn't it? What you do is you go straight and do what? Go to the hospital and access care and sign off and be off. So how will people know that? People will know that if you know more about the social media space. Let's go to something else that we do, telemedicine. And sometimes serious things can make, social media is tended towards things that will make you laugh, right? Serious things can make you sound boring, right? But don't get yourself bored. Let's innovate. Let's find how can we introduce some of these very serious things into the very interesting things that we put out there, right? Because if I leave here, one of the things I want to do is woo some of you to be part of the education wagon for our city. Do you understand what I'm saying? And make change, because change is vital. So we have this app, ECEWS, that's Enhanced Expert Support Initiative, where we try to ensure that in the primary healthcare center, that nurse, if she has challenges with caring for a patient, she can connect with a doctor in the teaching hospital just through the app and get some guidance, some capacity, and immediately act on it. So if in the next slide, go to the next slide, you would see sort of a traction, book an appointment. It allows, let's say a patient books an appointment with a primary healthcare. Well, that doesn't happen normally, isn't it? So the person goes to the primary healthcare unit, sees a nurse or a CHU, and requests a consultation. So that CHU, depending on what's being presented, right, what the patient is presenting with, can connect with, through that app, with a specialist. Let's say there are issues that bother on a heart disease, then there's a cardiologist. Are you getting me now? Linked on that app. That is happening in Akwa Ibom right now. Well, we're not politicians, so we're not interested in the clap for that. I'm just telling you. We're just letting you know that that is happening. It will go to scale, particularly for HIV positive persons, but also cascading to other persons presenting in that facility. So that's another way of really, because one of the challenges is poor diagnosis, isn't it? Poor diagnosis leading to and then, this doesn't work so well, but that's okay. So a lot is poor diagnosis. And once you have poor diagnosis, like what we're doing in Enugu now, what we're trying to do is test before you take malaria drugs, isn't it? Not all fevers present, malaria is not, every time you have a fever, it's not a malaria. Do you get my point? That's normal for us here, isn't it? But once you have fever, so how do we educate people? We need them to do a test, even if it's a rapid test. And, that's just telling you how easy these apps can help to connect people and make it work. So I think if we look at all of that flow, you can see that the patient is able to get support. Why? Because this nurse has connected with a specialist and has some guidance. And if the nurse needs to do a total referral, the nurse will do that referral. Are we clear? So that way the quality of healthcare at that level is enhanced through the use of this app. It's just an enhanced app, simple app but then the challenge is also smartphones, isn't it? How many people have smartphones? We've had to provide smartphones in facilities where these things work. What we've also done is we provided internet access. So when we signed an MOU with CCS Mobile, not too long, we put them in a couple of facilities. We've also put Elon Musk Starlinks in about 20-something facilities. Why? So that facility now is sort of covered with internet and doesn't need much. And that way we are able to ensure that the app works and other kinds of digital health processes that we put there. Because some of them we provided, we provided computers, all-in-one laptops, very high-tech laptops, which you will see as we progress. Okay, so the next picture will show you a bit of how that works. Experts from tertiary hospitals, providing that service, and then it's reaching out to the patient. You can see a doctor seeing a patient there, you see a community worker reaching out. We also have what we call the Adolescents Lounge. So this is a virtual platform, it's part of the app. So adolescents can actually get into that app, specifically for adolescents and young people to access trusted, young, youth-friendly services. However, even including sexual and reproductive health. So this digital health, the challenge of digital health is penetration, isn't it? And so even with the internet access, look at like in this hotel now, we have challenges with the internet a little bit, isn't it? And we have to come back to the hotel internet. But in our rural areas with a Starlink, that has been made easier because it works, and it's supposed to be a satellite platform. So apart from the adolescents lounge, we also use WhatsApp a lot. I mean, I like what Oganyene said. WhatsApp is very authentic, isn't it? WhatsApp is very, very useful to all of us. We link all of those PhD staff with WhatsApp systems. So there's a WhatsApp group linking everybody, including our staff. I mean, we have about community workers, close to 1,600 of them across Akwa Ibom alone. All of them are in a WhatsApp group per local government area. So they talk to each other, they meet, and they make sense, they share information, they support each other with information. So if you go to meet a patient and then you have challenges, you can actually talk to your other case manager colleague and gain support. That's what digital media has done in terms of trying to assist in making sure that the quality of primary health care, because what's primary health care? It's just meant to have better outcomes, isn't it? People go to the primary health care, get seen, and then they come out going out well. The challenge is that if they go there, which is a major challenge, people go there, they meet nurses, we no longer have enough doctors. We'll just do a smart check on the doctors. I know His Excellency the Governor has actually approved, I think, hiring of quite a few healthcare personnel. But if you go out there, you don't see doctors, you see nurses. In some cases, you don't see nurses, you see shoes, isn't it? So if you're seeing those lower level people, how do you get quality healthcare service? Because you can't give what you don't have. And that is why telemedicine, digital media has become that bridge, which is still being enhanced. And this thing it has to be utilized well to make the progress. I mean, if you go to the next slide, you'll see us using a mobile X-ray machine. That mobile X-ray machine, we just hang it at the back. The radiographer carries it, and it's meant to enhance diagnosis of tuberculosis. Now, we've had many missed cases of tuberculosis across the state, across the country. But this is an AI-driven facility, so that's a huge. It's all set up. If once it's packed, it's like a backpack. Person carries it like a backpack and heads into the community. But that's such a major machine, doing far better work than maybe all the X-rays we have in the States, frankly. That's the truth. Yes, it's more modern than maybe all the X-rays we have in all our hospitals. Because it comes away with an AI, clear sort of, the diagnosis comes and then the doctor only confirms that. Are we clear? Yeah. But it makes the doctor's work very easy because, we've missed a lot of tuberculosis cases. And that the challenge is that if one person is off with, let's say, an XDR, then can infect so many other people. So that's what digital media, and then, so this tool has immediate decision, isn't it? Yeah. After you've done the shooting, you send it goes to the clinician, and it comes back to you, and you can actually commence that person immediately on drugs. Because many times when you find people, if you go to come back, what happens? You don't find them again, isn't it? So that's the power of sort of how we've been able to use technology in the community to ensure that as much as possible, many people are doing well. Okay, in the next slide, you will see where we signed MOUs with the state government, the Ministry of Health, the Commissioner of, where we're presenting these packs. You can see the blue pack there. That blue pack, that's that whole thing. All of this is a backpack X-ray, isn't it? Yeah. But it's very heavy. Next slide. So if you look at this, in 12 months, about 12,000 guys have been seen through that. One of the things that we've also done is, really providing situational rooms across the state. So you can see that these are opportunities for training and for data, because data is very key to what we're doing. We have data platforms across the state that collect data, like electronic medical record systems. And those systems communicate with a central system, a platform, and allows us to know what is happening and what level of support we need to keep giving. So the state government folks can sit in just this room and monitor how many diagnosed cases of HIV or diagnosed cases of TB or whatever, just from that screen. We set that up within the Ministry of Health, and in some facilities this is also set up so that we can make sense of what's happening, because information is power and it's data-driven services. So, and how does this work? This works with interface with computers that we put in facilities, trained personnel, data, clerks who collect primary data, feed them in there. They're also uploading that to a platform called the LAMIS Plus, and that LAMIS Plus communicates with a national platform called the National Data Repository. You see, all of this allows both at the state level and at the national for them to be able to see what's happening, say, in Akwa Ibom State. That's the level of support. And what does that really do? With more data, there can be better service delivery. Quality of service can improve, isn't it? Yeah. And then we can know what's happening there. Because in the long run, I want us to always see that patient that comes, or that woman that is pregnant, isn't it? That comes to the hospital. Is the woman able to be cared for? How is the woman cared for? How does digital media support that process? That woman is able to come deliver her baby, or that person is coming down with malaria and is able to come there, get access to care and treatment, or the person has come down with HIV and is being managed very well. How? Through the use of digital media. If we go on, we can see a more intense way that we have used using GIS, technology, which I think some of us also need to advance into as we progress. We have this platform called Edgar, which we just introduced, which leverages GIS to collect, manage, visualize, use spatial data. Data is very vital, particularly in the context of public health. When you're trying to understand an epidemic, or you're trying to understand where to direct resources, then data becomes important, and that resources actually amount to, or even human resources. So you begin to know you need to send more doctors to this place, or you need to send more nurses. This aid in decision making, that links to better quality of primary health care. I think Akwa Ibom is doing better than quite a number of states. I mean, I came from Ekiti only within the week. It has real challenges. I mean, we had 3 doctors who worked there who were offered appointments with the hospital, with the state government, and they rejected the appointment because of the money. And we feel sad about it. We're trying to get more. But they don't have doctors. They don't have. Akwa Ibom has a few. But as a state, as a country, we really are going through the brain drain. And these things affect outcomes at the primary healthcare level. So the next one, you can see mapping. So this is actually a GIS map. If you look at it, just giving you telling you where what is. This is between Akwa Ibom and Cross River. In terms of facility, those identifying both facility and community. And because one of the things that we need to do again is the community infrastructure. We have at least a PHC in a ward in Akwa Ibom, but a ward is made up of many villages, isn't it? Yeah. So how can, we get people to access care? Sometimes you go to these PHCs, there are no people on board, nobody around. So through monitoring, we're also thinking the ministry needs to use digital media in the course of monitoring, isn't it? If they use digital media, they can monitor if their facilities are open and are providing services. So, those are things that we can think about. Go ahead to the next one. We're developing an AI-powered chat box. So just something that can continue to, but again, this is limiting because this chat box will only work with people that have smartphones, isn't it? That, for me, we respect the fact that we're trying to introduce this, but we also think as we progress, but then how do we fix it? So we're getting PHCs to be like digital hubs, isn't it? Where these things can work from, right? Because if people from the village go there, what does it do? It assists frontline healthcare workers in primary healthcare centers to quickly respond in technical areas of care. So it's not yet deployed. I think it will be deployed soon. We're just finalizing on the rollout of this, but we thought we should share that with you. Next slide. And I think Dr. Bala is here. He's a user of the resource. He can talk a lot today. We have the DIRA, which is like a robotic automator. This allows us collect data from the EMR and just sends it up to the DHIS. Now the DHIS is like a district health information system that is more statewide or national. So we've been able to develop this robotic process that allows those records to quickly rush into the DHIS, and if we look at it, it's a digital media. It allows data to move from place to place. Why? The long-term goal of this is so that there will be better healthcare outcomes at the PHC. Okay, keep going. So you can see when we signed the agreement with go to the next slide, please. Thank you. We have 21 facilities on CCS Mobile, and 36 of them have Starlinks. Starlink's not very cheap to put out. We intend to put it in quite about the 104 facilities that were, or 161 facilities that we're supporting. Because without internet, nothing can work. We think this is something also the state government needs to take very seriously. Go on, next slide. So one of the things that we have tried to provide as a solution is power, renewable energy. And because we found out that, we know that all of what we're trying to pull together runs through power, isn't it? Yeah. In our private alone, we have expended over 400 million in putting power infrastructure in about 50 facilities. And including teaching hospitals. So in teaching hospital, we put 130 kVA solar system to support the diagnostic lab there. In different primary healthcare centers, in fact, in many of the primary healthcare centers, like the one in Okobodi, it is the solar system that we provided that they use only. That means they're not even connected to the national grid. But through that, they're able to use digital media. Are you getting me? Because that becomes a support system for us to monitor and evaluate. And, so just taking us through these are the things that really are happening within us that we all need to take note. So about solar installation, about 55 PHCs. You can see them there. Some of them 10 kVAs, some 5, some 3, some 2. We even put in a court. So beyond healthcare, we've put them in schools and in the courtroom in our back. Because power is so important, isn't it? Yeah. We all need solar. I can imagine the work you do. You must have power. So even if you have a power bank, you have to power it from somewhere. If your power bank doesn't get anywhere to power, then you really still don't have power, isn't it? Yes. So I think there must be you need solar, even in the most micro way, to power your phones and your digital tools to keep working. So you can go to the next slide. We thought we should show some pictures. So this is like a platform we put out there. Here this is a 130 solar system. So we put, solar panels all over, and this facility is powered through a hybrid system. So there's very little NEPA, I think. There's a generator that we power there, and there's also the solar. Particularly in the rainy season, we have a lot of rain, right? And solar may also be challenged if it has to go 24 hours. Now, if you go to the next slide, you see the solar, PHCs, primary healthcare. We've now transited to providing not just this type, but more lithium batteries that has 10 years warranty period. Go to the next slide. So these are the various PHCs. For us, we had to talk about this because power is so important to digital media, isn't it? And that's something we've done across the country. Right now we're putting 100 kVA solar infrastructure in NIMA in Lagos. Now NIMA is the Nigerian Institute of Medical Research. So that will help the diagnostic lab that is like a reference lab for our country to work. We work out of Lagos. We support so many facilities across the country, frankly. We support Lagos State, we support Delta State, we support Ekiti, Osun, so many states. We have large offices in those places that work with young people like you, and we have young people like you in our digital space, in our IT space, innovating, finding solutions, tracking these platforms. And also we have a good communications team, and thanks Abraham. Abraham is one of the leaders in our comms team. We believe in young people. What you do a lot is communication. I'll call it digital communication, right? Or digital advertising, whatever you're doing. But we think we're hiring a few of you to do very positive work within the healthcare space. If you keep going, you will see some of the computers, all-in-ones, things like this, all-in-ones. They're very high-tech systems. Most of them touch screens, i7s, and then tablets, laptops, quite a lot of laptops. Across the country, I think we've supported, we partnered with Kunga And I think it's sort of vendor partnership. We've procured over 1,000 digital pieces from them. That's including i7 laptops. All of our staff actually, all of our core staff, that means there's 61 staff, they all use very high-tech i7 and in few cases i5s touchscreen systems. Now we started doing that a long time ago because we're very intentional about what kind of thinking. When you have that, you have the world at your feet. You have high-speed internet, you have a very fast system. In fact, in our data management, we use i9s and even maybe higher versions. I think i9s, these guys, because we use Python, data analysis, and I think one of the things we also think is integration of social media. Don't just stay within social media, but also earn some digital skills in other areas like data analysis. Just, find a way of both serious and unserious. If I want to use that, forgive that term, right? Do the ones that look more boring and the ones that, so getting skills, because you never know which skill you're going to need to use. We see you becoming superstars for us in Akwa Ibom. So Akwa Ibom is a vibrant place. This is one of the best places. Let me just tell you guys. We work in all of the south and work in some of the north. In fact, many times I'm in Lagos, my internet doesn't work as well as it works when I'm in Akwa Ibom, when I'm in Uyo. And if you're moving around, so again, take advantage. I'm just trying to let you guys know. Or even, we are in a very good place. Friends came in from the US. We went around, they're like, the roads in Uyo are better than the ones I saw in Lagos. Even the ones on the island. That's the truth. We have an airport that comes in. So, a science park. I see you guys as very important people. In fact, we're going to need to depend on all of you to make progress. That's the truth. That's the truth. But you have to see yourself as that person that will be needed to make that progress, isn't it? As social media communicators, you control a lot of things. You control people's thinking, you control people's actions. But you'll be held accountable for what you do, isn't it? You will start by holding yourself accountable. The law, they're trying to still navigate the law around social media, isn't it? We're very mindful of the law sometimes looking like it wants to stampede social media. They're also now looking for a law that will manage AI. Even in the US, they don't still understand how to manage AI it's crazy, isn't it? But I think only the authentic will stay the journey. I want you guys to be the very best. So Akwa Ibom is that place that I think you can achieve so much. And that's why I believe in you guys. The governor, I think, does. That's why I saw Arise on this. I think he supports this a lot. We all support you. In ECEWS, we're open to you. Read about us. Check the social media. Find out more. There's a lot more that we do that I didn't even talk about. But find help and reach out to us through an email or through, something, and then we'll just be around the corner. We might just become your next best friend. Thank you, guys. Thank you for listening.
All right, thank you so much. Usually we take questions. I don't know if there are questions.
AJ, I have two questions, Dr. Ayo. There is still skepticism, when it comes to using digital systems to assess healthcare and all of those things. And then I am worried that, especially with AI, there are systems that you can build now without necessarily coding. Just a couple of things here. How do we navigate, issues of security somewhat to ensure that whatever is responding to you at the other end, or whomever it is a trained healthcare professional, or that the system has been set up by healthcare professionals? My second question is about some of the work ECEWS has done with providing solar power and other facilities. Now, you mentioned the battery that has 10-year warranty. So my question is, how is ECEWS working to ensure the sustainability of the work that has been done in these areas? Because in 10 years, it's likely that those materials will wear out. Yeah. And that if the care is not taken, the work that you have done will also begin to fail. So what are you doing to ensure sustainability? Thank you.
Okay, thank you so much.
My name is Asupo Edem. You're talking about leveraging digital media to improve primary healthcare and community engagement. My question is, how does Dr. Ayo get to leverage on digital media to run daily activities wherever you are, at any point you are? How do you get to use digital media to run the services? Thank you.
All right, thank you. We'll take responses to all of that.
He will respond to some of the first, but before I give it to him, so I think cybersecurity is a major thing, just like you said, my brother, how are you sure he's a healthcare professional? I think that's why the app does have some security fittings, and security is never absolute, isn't it, in the digital space? That's why you get, you have to keep updating, but like I'm going to talk a bit about that security if you want.
Yeah, so great question, and there's still a lot of discussions in that space. I don't know if you've seen what Elon Musk is doing with Optimus. Optimus is a robot that will soon start doing surgeries. So it's an evolving space, and for us as clinicians, I'll tell you this, that we are not robots, because to be a clinician, to be a surgeon, to be a doctor, you need the knowledge, you also need empathy, there are times you need to make certain decisions that the robot will not have. If you play with your ChatGPT, there are certain questions you ask ChatGPT and it will tell you that I don't have emotions to respond. I don't have emotions, I'm not human, and it knows its limits. So right now, as clinicians, we need to be up to speed. We need to continue to improve in our knowledge. We need to beat the AI system. We need to also accept it and use it. We've talked about telemedicine. My own younger sister does surgeries with robots. You're sitting somewhere and then you're doing surgery somewhere else. So we need to accept it and use it. And definitely, I believe that if you go through the standard health systems, you can't sit down in your house and then you're chatting with an app that is not validated. So you need to go through the health facility and you are sure that the AI that a health facility is using is something that is standardized, and you're sure that you are chatting with a human being. Just like our ECEWS app, you need to be in the health facility to use that because we validated that. We know that the person on the other side is actually a human being and is able to respond to you. Thank you.
Just deal with it. Thank you, Dr. Bala. So for the solar powered system, well, our programs are in tune with the state government. So there's already a partnership with the state government to say, look, that's why we're telling you, we've done this. We spent maybe 12 million to put this 10 kVA solar infrastructure. Over time, I think the solar panels would have maybe over 15 to 20 years warranty, right? But the batteries, someone has to replace them, isn't it? So working with the state government, that is the only part. Sustainability is that somebody has to pay that bill when it gets to that time, isn't it? And I think that's the partnership. Right now, I think the United States government is in Nigeria to try and strengthen that partnership because Trump, as you all know, last year there's a lot of terminations of grants, and more will happen. That's the truth. So really, our government needs to begin to invest. And so what you asked was a super question. Are we clear, my brother? And it shows that we have thinking guys in the room. On how do I use this digital media? So I use it all the time. Like I'm already using it here, isn't it? I approve work. I work everywhere. So I'm in China next 2 weeks. I'll be working. I'll still be approving stuff. When I was in the US, I'll still be approving stuff. So anywhere you go, you connect with the system. It's like a hub. We have an Azure system, which is dedicated. So it's also a closed system with firewall systems that tries to ensure that issues around. In fact, we have a lot of community or computer science students from the University of Uyo and Akwa Ibom that have come to intern in our IT unit, and they've been amazed. They just come out great guys because we track everything. Look for where the whatever threat is coming from, neutralize it. But like I said, nothing is absolute, isn't it? You just keep updating and putting the right things. So I use digital media all the time, guy. You just need it. Just like you're doing social media. I also post. I'm also one of the communicators. And the truth is that content is difficult to create, isn't it? Content is difficult to create. You have to actually have the right context. So I can create some context, share it with my comms team. They maneuver that content. Are we clear? And then we have to always see what, and for content, always think of when the other person sees it, what will it be seeing? So again, if you have a way of double checking what you're about to post with some partner, I will advise you have some digital partners that you can share your post with, and then they validate the post. Are we clear? So let them be your trial. That means they look at it and say, this is what I see here. Then it's okay, this is what I want to communicate. Because communication is a two-way system, isn't it? Yeah. So you reduce your errors and ability to make, to apologize. So every time you apologize, you lose a little bit of credibility. Are we clear? Yeah. Unfortunately, but it's better if you apologize though. The credibility can come back. But if you continue on the lying path, you lose it completely. But it's better if you don't even. Carelessness is expensive, isn't it? Yeah. Just be cool and don't make mistakes. Mistakes on social media are very dangerous. They can cause suicide. Thank you.
Ladies and gentlemen, let's hear it for Dr. Andy Ayo. Doctor, you just stand somewhere in front. Let me invite the chairman of the Chancellor of Cooper to kindly step forward for photographs, please.